A lot of people are always saying, you're using a medication and there's no FDA indication for that, or you're doing an epidural steroid injection. Well, the FDA has no indication for that. This procedure, there's no FDA indication for that. To be honest with you, the way we utilize medications and certain procedures, they don't have an FDA indication. Now, that doesn't mean it's unsafe. There's oftentimes a plethora of evidence supporting the way we utilize things before there's ever, if ever, an FDA indication. For there to be an FDA indication, someone would have to apply for that FDA indication, and they would have to prove to the FDA via certain studies, evidence, etc., that it's safe and it's effective and it's at least non-inferior or sometimes superior depending on what you're applying for, and that costs money. And when it's a generic drug or an old procedure, there's no incentive for someone to apply for an FDA indication when it won't change anything, because a lot of these things are already written in the guidelines, right? The societal guidelines have already reviewed the evidence and said it's safe to do this because, well, the evidence is there. So we don't need the government per se to say that a procedure is safe for us to know it's safe, because frankly, I think that research and scientists are better at saying things are safe than just a random governmental indication.